You're listening to a brief excerpt from Social Determinants of Health, Turning Potential into Actual Value, sponsored by LexisNexis Healthcare, with Aaron Benson, Director Market Planning, and Rich Marino, Director Strategic Solutions. This webinar discusses elements of success for social determinants of health and opportunities for health plans to leverage social determinants of health data to attain quality goals while managing cost and enhancing member experience.
Specifically this afternoon, we want to cover two key objectives. First, we'll examine what is needed to deliver success with social determinants of health. This will include debunking common myths about socioeconomic data and revealing the truth about requiring correlation to health outcomes. We'll also look at previous generations of social determinants of health and what is required for success. Our second objective is we will discuss how social determinants of health innovation can impact quality goals while reducing costs and improving member experience. To do this, we'll look at examples of ways social determinants can enhance predictions as well as impact care coordination. We'll also address the importance of identifying combinations of socioeconomic factors in assessing member risk. A scenario will help bring the discussion to life so you can see how the socioeconomic data can enhance your workflows.
So now that we've examined the myths surrounding social determinants of health, let's dig into the pitfalls that our industry has encountered so far and what is needed to overcome those previous challenges and successfully generate positive outcomes and value. The first phrase, while the phrase social determinants of health is in vogue currently, if you boil it down to attempts to marry claims enrollment data with outside member intelligence, that's actually been going on for some time. First generation of this was focused on community data, which Aaron alluded to previously, which could provide some insight around a member's neighborhood and community. The problem is that it completely missed all the other categories of social determinants of health, which really require member-level information. Additionally, as Aaron also alluded to, while some neighborhoods are homogeneous and assumptions can be inferred, other neighborhoods, oftentimes in urban areas, have luxury condos and Section 8 housing literally next door to each other. This makes drawing any useful information out of them challenging at the least. The second generation attempted to overcome this by evaluating data sources that could provide member-level detail, but that really weren't built for any healthcare use cases. These were often data sets from marketing companies or strictly consumer data companies, as well as a few other sources. And while they're excellent for their original use case that they were built for, their match and fill rate tend to fluctuate widely. This lends it very difficult to analytics people trying to build models. Additionally, they're often seen as data dumps that require analytics teams to reverse that 80-20 rule and spend an inordinate amount of time simply examining the data and deciding which, if any at all, attributes could be used for modeling. So if we're going to cross the chasm and from an interesting idea to actually delivering value, the first step will be working with data set that addresses all the categories of social determinants of health and provides member-level detail.
So, Rich, when you walked us through the different generations of social determinants of health data, it made me start thinking about the different generations of questions that I've received in the market over the years. So when I first started working on socioeconomic solutions, the most common question that I was asked was, why is social determinants of health data important? But today, the most common question I'm asked is, how do I incorporate social determinants of health into the workflows? How do I achieve that value? And I think that speaks to that last poll question where people aren't really quite sure yet how to integrate it into their flows. So hopefully we can give them some ideas. The most common way of utilizing social determinants of health data so far has been to incorporate it into existing claims-based predictive models to improve predictive accuracy or to use it to create new predictive models. Our data scientists have found hundreds of correlations between socioeconomic health attributes and actual health outcomes like total cost, hospitalizations, medication adherence, and emergency visits. So this is a valuable and viable use of the data. And this is where it fits most easily within existing workflows. But the second use is for care management purposes, and this is where social determinants of health can be truly transformational. We recommend as a best practice to use social determinants of health not only to build those predictive models related to health outcomes, but also to build models that identify health barriers. These barriers can include determinants such as social isolation, which can be predicted based on attributes related to proximity to nearest relatives and associates, marital status, number of people in the household, and more. You know, I found it interesting that earlier this year there were news stories that the UK had appointed a minister for loneliness. And it sounds like a strange title and such a unique concept that it was largely mocked in the news. But the reality is that social isolation and loneliness are correlated to negative health outcomes, putting the individual at greater risk of cardiovascular disease, dementia, depression, and anxiety as examples. But imagine the impact that could be had if you could identify who was likely to have that social isolation and get those individuals into support groups or arrange for more frequent follow-up calls. Other areas of barriers include educational disparities, high poverty rates, neighborhood safety concerns, and there are many more. Information on education can provide insights into low health literacy levels and incomplete perceptions of health, which may indicate the need for more education or differently designed education, like providing videos to help members know how to take care of their own health. High poverty rates may indicate the need for financial assistance. Neighborhood safety concerns, which, as you mentioned before, can lead individuals to not exercise because they're afraid of being outside, but this can worsen obesity and other conditions, so it may mean that we need to find other ways for them to safely exercise. These 4 listed on the slide are just the start of different social determinants of health barriers that may exist for an individual member that could be determined and addressed using socioeconomic insights and modeling. So by using the data to build models that predict the likelihood of different health outcomes occurring, payers can prioritize members for care based on their needs. Then, by building models that identify health barriers based on those social determinants, payers can also inform clinical care operations about the types of interventions that will be needed to improve health outcomes. In doing this, everyone wins because member health improves.
You've been listening to a brief excerpt from the Social Determinants of Health, Turning Potential into Actual Value webinar, sponsored by LexisNexis Healthcare, recorded on April 18th. The full interactive webinar with audience polling and Q&A discussions explores the myths and truths associated with social determinants of health data, offers examples of how the right data correlates to health outcomes, and the importance of identifying combinations of socioeconomic factors in assessing member risk. Feedback from the live webinar audience included accolades such as, "I found this meeting to be very informative. It sheds some light on the basis of health disparities, especially in the management of chronic conditions." "Nicely done. I like the Mythbuster portion." And "Excellent presentation and quite timely." You'll want to be sure to watch the full 1-hour webinar video, now available on YouTube, at the link indicated on your screen.